You could start now.
Okay, thank you, Shruti. Good afternoon and welcome back to the final session of Day 2 of the 14th All India Conference of China Studies, organized by the Institute of Chinese Studies and China Bhavan, Vishwa Bharati University, in partnership with Konrad Adenauer Stiftung. The theme of this special panel is Social Dimensions and Disruptions Caused by COVID-19 in China and India. And to moderate the discussions, we have with us Dr. Madhurima Nundy. Dr. Nundy is Assistant Director and Fellow at AICCS. She has several publications and has been a regular contributor to policy analysis in the areas of public health in China and India. Her most recent publication, which is titled Commercialization of Medical Care in China, Changing Landscapes, has been co-authored with Professor Rama V. Baru, our discussant for this panel. Professor Rama V. Baru is professor at the Center for Social Medicine and Community Health, JNU, and honorary fellow at ICS. She's also honorary fellow at the Indian Studies Center, Central China Normal University, Wuhan. Currently, she is member of the Ethics Committee at All India Institute of Medical Sciences and the Technical Appraisal Committee for Health Technology Assessment with the Ministry of Health. Professor Baru and Dr. Nundy are joined by 4 speakers in this panel. The speakers will be introduced by the moderator before the presentations. Before I invite Dr. Nundy to begin the proceedings, let me lay out the housekeeping rules. All participants except the speakers will be muted during the duration of the event. Participants are requested to send in their queries via the chat box or use the raise hand option. Please unmute yourself only when called upon to do so by the moderator. Now I will invite Dr. Nundy to kindly begin the proceedings. Over to you, ma'am.
Thank you, Preksha. Thank you so much. It is my pleasure to welcome you all to the 3rd special panel of the 14th All India Conference of China Studies. I welcome all the panelists, and I'm really grateful that they agreed to be part of this special panel. The panel specifically looks at disruption and the social dimensions of the pandemic in India and China. One could always have a separate conference on this issue because there are so many vast areas that need to be covered within what happened actually in the last 2 years. But here we bring in a select set of speakers who have looked at the massive disruption that's taken place in the last 2 years on lives and livelihood globally, as well as specifically in India and China. The cost of lives has been huge, and those who survived have been affected severely. While it was a lesson for humanity, the pandemic has also been a lesson in social sciences. So we see that it quite dramatically affected all societies throughout the world, and it exacerbated all inequalities in society and perpetuated discrimination, stigma, fear at global, regional, and local levels, national and local levels. We have several anecdotes from the lockdown stories within China and India. I mean, of course, Wuhan's, the Fang Fang's Wuhan diary was one of the first ones which kind of gave the experience of individuals within the lockdown and what was happening as on a day-to-day basis during the 76 days in Wuhan. Thousands within India, we have seen thousands. We've seen walking from major cities during the lockdown and mostly from the national capital. They were moving to their villages thousands of miles away due to the uncertainties of the lockdown, and many perished during this journey. We also had the whole rural population. While the urban context was definitely much more in focus, we really don't have much about what was happening in the rural parts of China and India. Here, I think Cody's study on what was going on during the lockdown in terms of the socioeconomic impact of the lockdown in rural communities in China would be very important, and we thought that was important to bring forth. Apart from the loss of human lives, economic, social, and psychological costs highlighted the failure in governance and trust, and there was a breakdown of trust. And we also saw a lot of civil society organizations and all coming out to help, and which is something that Bhim will be covering in terms of what kind of philanthropy and charity work was extended to communities in this crisis. So our first speaker, without much ado, I invite Professor Biao Xiang. Professor Xiang is director of Max Planck Institute for Social Anthropology in Germany. His research addresses various types of migration in China, India, and other parts of Asia. He is the winner of the 2008 Anthony Leeds Prize for his book, Global Body Shopping, and the 2012 William L. Holland Prize for his article, Predatory Princes. He has several books to his name, and his work has been translated into several languages. Today, he looks at mobility and immobility in China during the COVID lockdown. How was the society coping with sustaining these restrictions, or immobility as he calls? And what does mobility and immobility actually mean in the context of lockdowns? There are some who have to be mobile while others to protect the rest of the immobile population. So he looks at the infrastructures and logistical power used to sustain these restrictions on mobility. So without much ado, Professor Xiang, I invite you to give the talk. I'll give you a reminder once your 10 minutes are up so that you can wrap up your presentation in the next few minutes. The floor is yours. Thank you.
Thank you so much. I'm very, very pleased to be here for a number of reasons. But one of the most important reasons, also probably most immediately relevant to what I'm going to present, is the fact that what I'm going to present is very tentative and is based on my observation about China, but with India in the back of my mind. So it is a kind of implicit comparison. Well, probably we can say it's interreferencing. It's not really, a one-on-one comparison, but it is focusing one, but with the other as an implicit reference point in order to highlight some key features or characteristics that in a particular case. I mean, I also wanted to use this opportunity to say that I left Oxford University, where I worked for 20 years, and I now come to Germany, Max Planck Institute for Social Anthropology, and I'm very keen to develop more China-India comparative or interreferencing style of research. I mean, the main value of doing so is precisely not to treat these two countries as two cases, but rather by putting the thing together, we may be able to generate globally relevant, broader questions. So that's the most important I want to say. All the rest is some specific questions that I wish to raise and to hear your feedback. I think one thing that I learned from during COVID, especially by observing what happened in China and India, is that in order to lock down, in order to stop mobility on a large scale in a society, you need to do at least two things. Number one, you need to redistribute mobility. And number two, you need to securitize mobility. By redistribution mobility, I mean, the government should be able to assign mobility work to some populations, for example, essential workers or delivery workers, and the civil servants. I mean, they should serve people at this critical moment. Assign mobility work to these people in order for other people not to move. It is not realistic to expect the entire population stop moving. The question is more about the redistribution rather than total halt. Securitization of mobility means interventions that will minimize threat associated with mobility. I mean, in COVID, we know that mobility itself potentially impose a danger of infection and the spreading of virus. So the specific means of the securitization can be, the protocols that protect key workers, the mobile key workers, and various, for example, apps, and the contact tracing app that is now widely used in different countries with controversies. But I think it's interesting to observe in any case. So I was thinking, so how are such capability or capacity of stopping mobility to some extent, and then at the same time redistribute the mobility, securitize mobility is achieved. So I'm thinking, toying with the idea of e-mobility infrastructure. E-mobility infrastructure, the IM is in brackets, right? It means the type, it's the whole social techno system that facilitate, condition, hold, redistribute, and securitize mobilities. So it's, I mean, previously I have been talking with my friend Johan Lindqvist. I've been talking about migration infrastructure, but now we think probably we needed to think in a broader way. So the e-mobility infrastructure. Then if you look at the case of China, we find that the e-mobility infrastructure is quite complex. And then I identify three important components in this infrastructure, which enable the government can stop and redistribute the mobility in a way that without dramatic, unexpected outcomes. I mean, Nundy just mentioned, I mean, everyone knows between March and May 2020 it's a cross of migrant workers had to go home on foot in India. In my view, is because the e-mobility infrastructure is lacking. There's no capability, enough capability to redistribute mobility and to reshape mobility in a flexible way. So what are the key components of such infrastructure? Based on empirical observation, this is not a theoretical framework. The components are, number one, apps are important, digital apps, which, for example, I mean, the Chinese government is quite keen to resume migrant workers' mobility, actually as early as February 2020. But then migrants, how can, I mean, at that time, it was still the peak time. I mean, Europe, it was before the peak of infection. And everyone must download the app, and you have to apply to go to a city beforehand, and you have to report your body temperature for 14 days before your date of departure. And of course, you have all this QR code show you whether or not you had any contact with infected cases in previous 14 days. So it's a really it's a monitoring tracing system, and only after you kind of pass such a screening on app, you are allowed to buy railway ticket or airline ticket. Otherwise, you cannot buy tickets. So it's an integrated system. Number one, app. Number two, we a bit of surprise. It was a bit surprising to us. We found that commercial intermediaries play a quite important role as a part of this infrastructure that can redistribute and shape mobility. They include like labor placement agencies, especially in the case of domestic helpers, and then the real estate agencies. Why do they play a role? Because when migrants come to city to rent accommodation, now the real estate agency play a role to make sure that the rented space is suitable for quarantine, because they are supposed to monitor the migrants' quarantine arrangement, which is very interesting because of actually a very difficult part. If you think of it from public policy point of view, actually in managing the whole pandemic situation is a requirement of quarantine, because it costs money and it's very difficult to organize collectively, right? How are you going to make sure that the people go through the quarantine? I mean, then actually commercial intermediaries were turned into agencies of social control by the government. I mean, I admit this probably is quite a unique situation in the world. I mean, not so many governments in the world can do that, but the Chinese government is able. You just force them, otherwise they will de-license you or fine you, whatever. And I mean, our empirical study was quite to find out that actually they comply quite well. All these private agencies, actually, by doing so, they acquire new power. For example, the labor placement agencies became more powerful after this, because now they say, okay, the government, I mean, migrants must follow my instructions, otherwise you are not allowed to start working. So they have certain incentive in doing that. And of course, the most important intermediaries is the platform companies. All these apps, etc., are most of them are developed kind of as a PPP formula, between government and these major tech giants. And the tech giants, of course, one also see potential benefit in doing that. And they play a kind of technological intermediaries, if you like, in creating this immobility infrastructure. So that's, did I say the three? And then the third component in this infrastructure is the residential organizations. In China, you have this, you all know, 小区 and 网格化管理. It's a great system of residential community, which is very important. They are the people monitor quarantine, and they are the people who send the food to the doorsteps of all the residents. That is critical.
Professor Xiang, just a few more minutes.
Yeah. So that is critical to enable the massive quarantine or self-isolation measures. So these are three: app, intermediaries, and residential structure organization create this infrastructure. And I will probably stop here, and I very much want to hear your observations, and especially how I can move forward if I want to develop this idea further. I mean, I have a second part of the paper is to talk about logistical power as a new type of power, or probably new dynamics of power. Now, I'm not sure. Everything is still very fluid. We still have to observe whether or not these things will become stabilized, in coming years. But at least during the COVID pandemic period, we see the emergence of this new dynamics of power, which are called the logistical power. It is a power. It is that the government is a type of state power. It's a dominance over society based on the government's capability of coordinating circulation of people, circulation of goods, and the circulation of information. So it is just, thinking how the government organize all the flows in this exceptional time. So it's not by directly control people, but it is by coordinating how things move around. It acquires dominance over society. That's what I mean by logistical power. So it's a different, it implies very different rationalities and also operational models as compared to other type of power. For example, despotic power or infrastructural power, they're slightly different. Yeah, thank you very much.
Thank you so much, Professor Xiang. That's very fascinating propositions that you have in terms of the infrastructural dynamics and what actually works to build up this immobility and mobility infrastructure, as well as the logistical power that you talk of, and how the state is actually taking control over people's movement, and also the people who are actually part of are mobile and need to be mobile during this period of time. So what are they, how are they also being controlled by the state as well as the companies that they are working for. In fact, this flows very well to the next presenter we have, Soumya Ashok. She is an independent journalist based in Chennai, and she was part of the first cohort of the China-India Visiting Scholars Fellowship 2020-21 at Ashoka University. She has reported in the past from Beijing for the Indian Express in 2019, and she has several stories that she has written in the paper. She does report on China, tech, and the environment, and also is learning Mandarin. But the title of her presentation is quite fascinating again. It's Algorithmic Governance and the Platform Economy Through the COVID-19 Pandemic. So here she looks at the role of the state in the platform economy, specifically looking at the food delivery platform during the pandemic here in China and India. She looks at state policies and the company diktats that affect the delivery workers and the protests that ensue thereafter. And how does the state respond to these, and how do the app companies also respond to this? I invite Soumya to make a presentation, and I'll give you a reminder again once your 10 minutes are up, and you can wrap it up in a few more minutes.
Sure.
Thank you. Thank you, Soumya.
Thank you. Just 1 second. I'm trying to share my screen and hopefully people can see this. Can you see my presentation? Yes. This is all good? Can you see the PPT?
Yes. Okay.
Soumya. First of all, thank you so much for this opportunity. I did this work as part of the China-India Visiting Scholars Fellowship, which, as it says in the name, was supposed to be a Visiting Scholars Fellowship. But since it was the pandemic year, I essentially sat in my hometown of Chennai and wrote about China. So it was quite challenging. A lot of this work was based on secondary information, looking through official company policy, looking at the Chinese government policy, looking at journalism around delivery workers in China, and then also, like Professor Xiang said, kind of keeping India at the back of my mind and trying to see what comparisons I can make. Sorry, just 1 second. So just to start off with, just to backtrack, for those who've heard me speak before, and this would seem like a repetition, I was a bit enamored by how much my life was transformed by tech while I lived in Beijing. So a lot of my time in Beijing involved my phone and no cash. So I was taken by how do big companies form trust in these situations? How do you get more people to sign up to platforms? How does that grow? How do you scale up? And China seemed like a good case study for me, at least with the pandemic here. So when I went into this fellowship looking at this topic, it was specifically to do with the role of the regulatory state. How does the state regulate a platform such as Meituan in this case, which is what I studied? But very quickly that changed because I couldn't go to Beijing and I was having to adapt to the conditions. I decided to look at the food delivery platform specifically in the year 2020 and how did that transform? What effect did it have on the company? What effect did it have on delivery workers? And how did the government respond to all of this? The one major factor that the pandemic has changed, and this is sort of common to several countries, right? You can look at the US, you can look at India, China, parts of Europe. It's basically taken what is an invisible worker, a delivery worker, and propelled them into a frontline worker. And this was especially the case in the early days when Wuhan went under a massive lockdown, right? That was the first example that we all saw in the world. And it was a clear transition of social discourse where everyone, all of us sitting in our homes, looked at this person who brought these goods and services to our doorstep as sort of the savior, sort of a frontline worker. So in a very specific way, it changed what was essentially a service that we didn't care for into a service that was deemed extremely sort of powerful in that time. And one major indication was People's Daily, the largest state-affiliated daily in China, which responded to public sentiment by ranking delivery workers amongst the top 10 occupations in that time. So this was quite the change in scenario when it came to domestically in China. So if I look at just China, and sorry for my very rudimentary and basic PPT, but just thought this was easier to explain. I'm looking at China in 3 different ways. As I said, the Chinese state, the company and the effect it all had on the final sort of foot soldier, the delivery worker. Now, before that, a quick note on the food delivery platform that I studied. And Meituan is one of the biggest food delivery platforms. It's not just that, it's much more. And to give you a quick sort of synopsis of what the app is, it started as a Groupon clone with a founder who previously started a Facebook clone and a Twitter clone. It's sort of a Yelp-esque DoorDash of China. This AI-powered food delivery company is also a ride-sharing company, a real-world supermarket, a merchant analytics platform, a fintech platform, so on and so forth. So essentially, it's a humongous tech company. And through the pandemic, it grew to the top 3, actually, quite prominently. So if we just look at the Chinese state, now let's look at the pandemic year and 2020. It stood out in the conflicting sort of signals it sent out, right? So at the beginning of the year, it said, how can platforms please help soak up the devastating effects of the global pandemic? It's pushed platforms to actually take on more workers. And this was already a trend that was going on in China for a few years because people were getting laid off from coal industries and so on. But what last year did was propel more workers from the informal sector into these kind of platform work, which is continuing in the informal space. This was also backed up by major top leaders in the Chinese government who all made this suggestion that platform companies need to take on this extra burden. So digital service platforms were egged on to mop up this excess unemployment that was spilling over. And this traditional wait and watch. So what happens, again, which is very common to the Chinese state, is to wait and watch how things pan out and then come in at a later stage in terms of regulation if things are not going as per plan. So what we saw by the end of the year was actually these anti-monopolistic guidelines that came into full force. Essentially, it was these draft anti-monopoly rules that affected big companies like Tencent, Alibaba, Meituan, all of whose shares dropped significantly. And essentially, these laws were aimed at protecting fair competition in the market and safeguarding consumers' interests. That's how it was defined. Now, this spilled over. This happened last fall. This spilled over all the way to this July. So this July, 8 departments under the Chinese government issued new labor rules for gig workers and big tech in China. And this was a huge step towards protecting workers engaged in new forms of employment, such as delivery work. Now, the government ordered that online food delivery platforms should not set evaluation criteria based on optimization algorithms and must respect the rights of delivery riders and ensure that they earn at least the local minimum wage with social insurance. So the difference is one led by tech versus one having a more humane sort of worker-oriented model. Now, looking at the company as such, from Meituan's perspective, frankly, the pandemic year wasn't all rosy. They did grow massively, but to begin with, things hit them hard, and the nationwide lockdowns increased the food delivery, but it did have impacts on various other sort of factors. But owing to public pressure through the pandemic year, both Meituan and its sort of rival Ele.me, so the two of these companies form up about 90% of the food delivery market in China. They committed to end the practice of forcing workers to register as independent businesses, which has long helped these platforms evade responsibilities as employers. As Professor Biao Xiang was talking about, these labor placement industries, so this is where these middlemen come in, and it basically allows the responsibility for these companies to just pass it on to someone else. The third and last sort of factor I looked at was the labor. Now, what's interesting about this is I start my essay talking about, and I want to clarify that I'm a journalist and I wrote a journalistic research essay. It wasn't based on academic work, nor can I claim that it was based on extensive ground reporting, sadly, but it's somewhere in between. And so I'm going to call it a research essay. And I start my essay by talking about strikes in Shenzhen and Tongxiang. So that happened in March of this year, which was protesting Meituan's new company policy that slashed pay per delivery. 2 months before these strikes, another delivery worker for Meituan's rival, Ele.me, as I mentioned before, set himself on fire in Taizhou, protesting unpaid wages. So these were rumbles that had started years ago. So these strikes are not new to China in the delivery worker space. Also, you have to understand that, again, unions there are controlled by the state. So the only way to sort of open any kind of protest against bad pay was to take to the streets. So what we saw constantly was people delivery workers taking to public places, holding up banners, stopping traffic. In fact, even colluding with restaurants and saying, you come to our side and we will, go on strike till we get our basic pay. So work had clearly built up through the pandemic here, and workers were very vociferous about the fact that they were not getting paid enough for the amount of work they put in. So simply put, when we talk about algorithmic governance, it's this. The algorithm is designed to create animosity between the platform user and the delivery rider, wherein the platform inherently shifts the pressure of receiving orders and maintaining a smooth flow onto the delivery riders. So all this is done without making any effort to regularize their contracts, keeping delivery riders in the realm of outsourced riders, and shirking any real responsibility towards worker safety and well-being. So one thing which I found which was fascinating was, again, around the time when the anti-monopolistic laws were being rolled out, Renwu, which is a local Chinese magazine, did an intense, like 10,000 plus word piece of amazing ground reporting, something I would have liked to do if I was there, and also if my Mandarin was much better, essentially looking at the plight of delivery workers. So it was in English, the translation is delivery riders trapped in the system. And the piece was shared over 10 million times across the Chinese internet as soon as it came out. And this was one of the signals of the Chinese government on how seriously the public takes an issue. And I've noticed this even when the air pollution issue came up. The virality of a piece of news and how often it's shared and talked about is also an indication to the Chinese government on people, starting to rumble about something and taking something seriously. So this news article took an exhaustive look at the plight of delivery workers across two of these prominent food delivery platforms. And it revealed the delivery riders had been pushed to the brink and were trapped in what is known as a sophisticated labor control system that they were actually unwittingly downloading onto their phones. But because they're wide-eyed by the prospect of earning more and more workers were getting into the gig economy. So what I tried to do, at least partially, was to employ the services of a young researcher called Chen Xiangzuo, who's based in Beijing. He helped me conduct some interviews in Beijing. These are screenshots of Meituan drivers. And this is, for instance, the daily delivery that they had. So you can see all the numbers indicate all the stops they had on the way. According to his research, the main complaint of workers about platform is that they feel that there's a huge gap between the income they receive from each delivery and the huge amount of work that they perform. And according to many—
10 minutes are up, so you can
sure.
Wrap up in a few minutes. Thanks.
So according to many riders, despite the post-pandemic economic recovery, the price per order was still extremely low. So what we keep coming back to, which we see also in India, is this: how much are you getting paid per? It mirrors the same, right? What do we have in terms of regulation? At least in that aspect, the Chinese government has taken a step forward. In India, there's barely any regulation on this space whatsoever. The companies have, in the same time, made huge amounts of profit. Both Zomato and Swiggy have made huge amounts of revenue. They've also termed platform workers as critical infrastructure. So in that process, have made more money. Zomato, as you all know, has even filed for an IPO earlier this year. Again, in India, you see a mirroring of the strikes. In Hyderabad last year, you saw an amazing sort of complete roll down of every Swiggy rider who came to complete stop in terms of going on strike for nearly 21 days to essentially say that we want better, 27 days for better pay. And to the extent that they got both a Swiggy representative and the local labor department head to come sit with them on the road and have a dialogue. So this was amongst the first that has ever happened in India where you see this sort of dynamic. In terms of key findings that I saw, in China especially, sort of regulating the platform has taken a layered path, and this has often been done from the point of view of coordinating with provincial governments. So that way there's a difference in the way we see how things have panned out in India. And the digital economy is sort of an evolving sector. So we still are in the nascent phases in India, and we can learn a lot more on how to regulate the space better. And more than anything else, I think what I just want to leave you with is how much the customer is taken and put as the god in all of this, right? Like if you look at my slide here, it says, say hello to so-and-so, just sit back and relax, your order is in capable hands. And here on the right, it says, consider me Mario and your order is my princess. So clearly we are, at the end of the day, the god that everyone has to sort of service. And in a country battered by a pandemic where delivery executives are using the same medium. So in what I found in India, at least, delivery workers are taking to Twitter now to completely and vociferously talk about all the exploitation they've been going through. And this is really interesting that they're using the internet to earn a living, but also to express dissent. So for us as consumers, and this is my last point, the ease of opening an app to access goods and services conveniently sort of forces a kind of cognitive dissonance. It's as if we are all collectively involved in playing a game, right? So we watch these tiny delivery workers moving around our space, and we kind of snap out of this when our doorbell rings and there's actually a real person there holding our packet of food. And what I hope to say and convey through all of this is I think it's up to us now to take a minute, have a chat, ask them exactly how their lives are going, and in our way be able to push back on algorithmic governance, push back on tech ruling the lives of people who are making our lives more convenient. Thank you so much.
Thank you so much, Soumya. That was really fascinating, and it's definitely a research essay, quite a detailed thing. And this is something that's been, yes, I mean, a lot of news articles have been covering. Of course, you had also written in the Hindu.
Yes.
So that itself was quite revealing. And the thing is, like, across the world, one is looking at these discussions of food delivery workers. I mean, it's come up in the last 2 years, in fact. And they were never considered frontline workers when the pandemic and lockdown started. But now, from being invisible, they are finally becoming visible. But one has to see like how the state and what kind of regulations and all are brought in to even bring them into an organized category. So I move on to actually Cody, Abbey. We look at rural China here. So from an urban context, from our two speakers, we look at what transpired in the rural communities during the pandemic in China. Cody, Abbey is a project manager at the Stanford Center on China's Economy and Institutions. He specifically manages research projects related to education, technology, and mental health, and has co-authored over 12 papers that have been published in reputed academic journals. He's part of the inaugural class of the Yanqing Academy at Peking University and completed his bachelor's in public policy at Princeton University. So, and his thesis during his for his bachelor's degree was about urban and rural attitudes towards the reform of China's college entrance examination, another interesting topic. Cody and his team at the Stanford Center actually documented the disease control measures used in rural China and also assessed the socioeconomic impact in rural communities over time. They conducted this study across 7 provinces, and their work has been published, because of which, I mean, when we read it, we realized that we definitely need to call someone from the center to talk about this. Cody, the floor is yours. I'll also remind you after 10 minutes that you need to wrap up. Thank you.
Thank you so much, Dr. Nundy. And thank you so much to the previous presenters, both Soumya and Professor Xiang. Soumya, I think, Professor Xiang laid a wonderful framework, theoretical framework to think about these issues and the power dynamics associated with them. And I think Soumya presented a wonderful case study of the food delivery services, which has always fascinated me. And also I've had much empathy for them, even though I was, much a somebody who benefited from their services while I lived in China. And today we're going to be presenting from a different perspective, which is from kind of a large scale empirical perspective, looking at how the pandemic, the lockdown specifically, affected China's about 500 to 600 million rural residents, which accounts for about 60% of its population. And I have to thank my team, including those both at Stanford and in China, because every time we do a survey, it's so large scale. we have to have multiple people working on the ground and on research to get all this data collected and analyzed. And so I'm definitely deeply indebted, especially to the PI for the project, Dr. Fan Wang, who asked me to give the presentation today, and then our co-director of our center, Scott Rosell. And really happy to be here today. And so I don't need to go over this, and we have very limited time, so I'm going to really try to get through most of this within the 10 minutes. We all know that in January 2020, that's when China issued the nationwide guidelines for both urban and rural areas, and that happened to coincide with Lunar New Year. Actually, I happened to be on a plane back from China on January 18th. Of 2020. And then I think the next day is when China issued the nationwide guidelines. And when I arrived in San Francisco at the airport, that's when I first learned about COVID-19. And my friends started to contact me in China about it. And my original plan was to go back to China 3 weeks later. That didn't end up happening. So I've had a change in my residence as well as just as Professor Xiang, although maybe for different reasons. And the restrictions were loosened fairly quickly. So by early March to mid-March, we already see outside of Hubei, which is the epicenter of the pandemic, we see that there were loosening of these restrictions, but we don't quite know what the effects actually were, especially in rural areas. In urban areas, we have some ideas in terms of employment. There were actually much protection of the urban workers, especially those with urban resident status. There's a study in about I think it was 64 cities that found that only about 2% of the workers had been laid off. So there were protections for urban workers in terms of their salary and furloughs, etc. In terms of education, we know that although it wasn't perfect, as it wasn't in the US for certain, urban areas have a lot of access to online learning infrastructure, and there is training for teachers during the pandemic as well. That was actually in some areas mandatory for the teachers to attend. And parents also who tend to be more educated in urban areas are able to help their kids with their studies. And in terms of healthcare, we know that there were a lot of these kind of fangcang that were established to help the overwhelmed hospitals and to separate, COVID-19 patients from other types of patients. And telemedicine was also fairly common in urban areas during this time. But in terms of the rural portion of the population, as I mentioned before, we don't know too much about the effects on them. And why would we want to look at this? Well, I mean, as I mentioned before, the scale of the problem or the scale of the rural population is quite large in China, and they're also quite vulnerable. Although in China, rural China has changed quite a bit in the last few decades, and absolute poverty has been, at least officially, has been eradicated as of 2020. But there's still a lot of relative poverty in China. Urban residents still make 2.5 times the amount that rural residents make. And there's also less protections for rural residents if they were to be laid off for a variety of reasons. And so we see that if we're able to better understand how the rural residents were impacted, then we'll be able to better understand, maybe potentially apply this both in China for the future, what kinds of policies should be designed, as well as maybe potentially in other countries, including India. And I'd be happy, I don't know too much about India, to be honest, but I'd be happy to hear from the speakers in the audience, how relevant they think this research is to India's situation, which I'm sure is quite different. But so that's what we're going to be looking at. First, we'll look at what disease measures were enacted. Then we'll look at how beneficial were these were these measures on lowering infection rates and deaths among rural areas. And then we'll look at the potential costs. So the benefits with the second point, the third would be the costs on employment, education, and healthcare of these measures. And then finally, we will look a little bit at actions to alleviate the impact. But I want to be very clear that this data was focused on one time period during the pandemic, which was during the lockdown in China, which was between January to basically April of 2020. So there have been many actions since then. And so this is really looking at one snapshot in time during the pandemic. And I won't go over, I definitely won't have time to go over our data collection methods, but I'd be happy to go over it. But essentially, we had a sample of 726 informants, and they represented 726 villages that we randomly sampled in 7 different provinces across China. And I'd be happy to answer questions about how we did this, but basically it was based on past research studies we had done. We happened to know people in these areas, and then in those counties, 60 counties across China, we randomly sampled, and then we randomly sampled one person per village to sort of represent that village. And so we estimate that this covers about 700,000 rural residents across China, because we estimate that there's about 1,000 residents in each village. And we conducted 3 rounds of data collection, so February, March, and April. And by April, by the way, we see very few, or if none, no COVID infections in China. So we see that most of the infections had disappeared by March. So that's important to keep in mind. And data collection, we had interviewers. This is somebody in Henan. They're calling up somebody, this man who's in a rural area in Henan, and that's how we conducted the data collection. I'm sure in other surveys too, phone-based surveys have become very common. We excluded officials, doctors, and teachers because we wanted to have a sample that wasn't biased. So if we're asking a lot of questions about health, about policy, these types of individuals may be somewhat biased in their responses. So we didn't ask them. And so we asked the different gaps in the research I just mentioned. Those are the topics that we asked in our phone call. And so moving on to our results. So we see right here that there were a lot of pretty strict restrictions on movement in China. So, but many of these by April had been removed. So we see that you couldn't go to your neighbors to go play mahjong, for instance. You couldn't go to the supermarket to buy, some sort of a dish for Chinese New Year. Like these activities, even going outside for walks, was not very common, not commonly allowed. But by April, when COVID infections were low, they were mostly permitted. We also see that group activities, larger group activities were not permitted. Going outside for dancing in the square, guangchangwu, all of these wasn't allowed. And then by April, about half of these still were not allowed by April. So these were a little bit more stricter in terms of regulations. We also see that over time, mask wearing was required both in February as well as in April with fairly high rates. And then luckily masks became more widely available by April. And based on what Professor Xiang had mentioned before, we see here some of the regulations that residential communities and the local party governments used. So you could see how cautious they were. Everybody would need to take their temperature had to be taken. And there was also passports that were required essentially to see whether or not this person was allowed to enter this particular village. In some areas, they actually use passwords, which is quite interesting. And this reflects how China's huge bureaucracy and the high level of state control enabled it to basically ensure that there was a high rate of compliance amongst Chinese individuals to these regulations. And here's just a look at one of the passports I just mentioned that restricted movement. In terms of the infection rate, we see a huge advantage towards reducing the infection rate in China. So among the villagers that we interviewed, only 4 reported that they had heard of any cases. And of these, they reported 10 in total. So if you extrapolate this to 726,000 residents that they represent, that's only 0.001%, which is actually close to the official rate at this time. And you could see here what would happen if you were found to have COVID in China. Like everyone would know because they would put up this banner and they would say, you have to be quarantined. It was very, the word of mouth in rural China, word travels fast. And so that's why we think that this data, we may ask like one villager per village, but we think that there's quite a bit of, a reason to trust these data, and because they're ordinary villagers. And the reason they're so low is possibly because most of the migration was limited to Hubei. So that's why in other areas of rural China, the rates were actually not that high, in addition to the strict quarantine measures. In terms of work, we see that actually quite high percentage of those were not able to work because workplaces were closed. And this was 31% still by April. And this is a bit of a difference in terms of policy, the official rates or data from the government. And we see that 22% actually were afraid to leave the village. Even if they were able to leave the village, they were afraid of infection. So they still did not leave by April to find jobs. So these are looking at each of these. Transportation was restricted. That was a barrier as well. Renting. And why was our data different from the official data? Well, the official data, we don't have quite enough time to go over all of this. A lot of stuff I need to get through this presentation, so 10 minutes is a bit short. But essentially, yeah, we don't have official employment information for rural China. The employment rates put out by the government are all for urban China, because unemployment is not considered to be a thing essentially in rural China. And so the data is not widely available. The independent listings we found have lower rates. We found that some listings were around 10 to 20% by a Peking University, by an independent think tank. But
another few minutes. Yeah. Sorry.
Okay. These were much lower than our estimates, because we focused on rural residents and we actually interviewed them. But the Peking University also conducted a study that showed that job listings were a lot lower for lower salaried workers than for high salaried workers, which makes sense because of the nature of these kinds of distance working, work at home measures. And unsurprisingly, we find that the income of villagers decreased during this time and was still lower in April. And also the price of common goods had raised, so that their spending ability had decreased during this time. Now the question is, well, what did the government do to counteract these measures during this time? With an emphasis on this time because we look up until April, and we find that by this time, about 20% of villagers had received any kind of aid, and that includes financial subsidies as well as daily necessities like would be oil and rice, these types of things. But 20% is not a lot, and that's unfortunate. And even if they receive financial aid, they would receive about 127 USD, which is about a quarter of the average migrant worker salary, which is around 550 USD. So it wasn't substantial. And when you think, I'm gonna have to skip this slide because I don't have enough time. When you think about, what did the rural residents do if they had this decreased spending ability and they didn't have support? Well, we find that the biggest trend was that they stopped spending as much money on food, which is a bit unfortunate because in previous studies, we have found high rates of anemia, especially among school-aged children in China. And so this indicates that if they spent less money on meat, iron-rich foods, vegetables, fruits, then there could be some potential impacts on nutrition of especially school-aged children or younger children. In terms of education, we found that schools were, as in many other countries, were widely not in session during this time. About a quarter had opened by April. And in general, we find that the opportunity to learn in rural areas was actually a lot higher than other rural areas of developing countries. So we did see a lot more teachers, engaging in these activities, and they got better at it as time went on. But we don't see that, we did see there were some problems. So some students had problems with internet connection. You could see on this slide, and there wasn't always two-way interaction. We see that in terms of devices, students were often on their phones. They had small phones where they had to use it. This is the contrast between urban and rural. I won't even have to say much more. It's pretty clear what the difference is between the education they received. And most parents did, or most individuals did report a negative impact on education. And this is unfortunate because rural students were already behind. And finally, I'll look at healthcare. Luckily, this is some good news. We found that healthcare clinics were often were open throughout the pandemic, and that villagers were able to buy medicine. Although there were some villagers that did decide to delay healthcare due to COVID-19, and telemedicine was a lot less available. So in sum, I probably don't have enough time, but essentially I went over all this information, probably too much to throw at you in 10 minutes, but I'd be happy to talk more, summarize more about the conclusions and look about how this may be relevant to India's situation in the future. But yeah, very happy to be here today to share this with you all.
Thank you so much, Cody. I mean, sorry that you had to rush through this massive study that you people did, but interesting findings definitely, especially when it comes to looking at employment and how work got affected and livelihoods were impacted, and also income decreasing and actually impacting food security and nutrition. And, so those are definitely, I mean, things that are takeaways from what was happening in rural communities also. And in fact, we don't have such a massive study that's been done in India at all. Whatever we have is anecdotal for the Indian population. So we do not have much evidence-based studies that have been conducted here on the rural community. But thanks so much, and I'm glad that we had the last three speakers speaking on the rural and urban communities and the state responses during the lockdown. Our next panelist, Bheem, actually looks beyond the state and looks at the civil society and philanthropy and charity during lockdown. Dr. Bheem Subba is an assistant professor of the Department of Political Science, University of Hyderabad, and a visiting associate fellow at the AICCS. He has a PhD from the East Asian Studies, Delhi University, and an MA in Political Science from JNU. He was the ICS HYI doctoral visiting fellow at GSAS Harvard University, a Ford student fellow at India-China Institute New School, and also a Confucius Institute Scholarship awardee. And his research interests pertain to China studies and comparative politics. Dr. Subba looks at the landscape of philanthropy in India and China, what's happening now, locating and identifying these actors, players, and constituents. He also is looking at motives of generosity, charity, and outcomes in crisis, and what are the relations these institutions and these organizations have with the state. And what are the departures in crisis philanthropy, as he calls it. So this is kind of preliminary work for him, but it would be interesting to hear him out. Bheem, the floor is yours. Thanks.
Yeah, thank you, Chair, and good morning, Cody. Very good morning to you and other speakers as well. And thank you, Chair, and also, asking me and actually trying to take me on board with regard to this presentation and the panel, which is, in fact, a very esteemed panel, and having, like my job is much easier now. Like I just have to focus on a particular area that I want to really, and in fact, as said by the chair, mentioned that this is the one that I was really trying to really look into it, and how observing, like on the Indian, philanthropy landscape during the COVID times, you could see many warriors and heroes being worshipped and I mean, say not paraded, but definitely talked about. So I was wondering, like, how was it that in China? And so how do we, and these two, countries or states are really discussing about philanthropy. So if I have to say, although the research that I'm looking into is mostly from many of those consultancy reports that have been published over the last 1 year, and one of the interesting observation that I found during reading and going through some of those reports was that the Hurun, rich list was not published by them. So I was wondering why they were not doing that. So is it first the Hurun philanthropy list that came out in India and China, then they're going to come out with a rich list, because that also showed that how they were trying to keep on the trying to shape out their perceptions about this consultancy, consultancy firms about it, how they're going to really make, their perception about these firms and all. And also one of the reports that I really looked into and dwelled was with the Tsinghua University Global Family, Research Center, I think, the Gates Foundations and the Gates and the the Warren Buffett Foundation, which they have come out with that research center with regard to philanthropy. So, and like having looked into both in India and China, I would say that with regard to the philanthropy that we see is there are umpteen, institutions, or so to say, the role of high alternate individuals or family foundations that have really contributed to philanthropy, or in fact during COVID. And the report that was carried out by the William Gates Foundation and the McKinsey report said that in China it was more than $4.4 billion during COVID pandemic. So what is that in India? How do we see that? So in India, who is that? So as in the March of 2020, when China was in the lockdown, as India started to go into the phase of the first lockdown, then we could see the number of family foundations and corporate donations being forwarded to the government. And by then, the government of India had come out with its own national disaster fund, which is the Prime Minister's Citizenship Care Fund, which until today, I think it has led to many so-called debates on whether it is also a statutory fund or not. Whereas in the Chinese case, we could see definitely the role of the state, a very important actor there. But at the same time, we could see these family foundations playing a very important and crucial role. So that brings to my second question is, what are the institutions, how these Indian institutions in India, like many of them, the citizens, they were ready. And after all, when I talk about the citizens, I'm talking about the retail contributions, or so to say, the crowdfunding. So some of my friends, or so to say, even my friends from the West who wanted to contribute, had a hard time figuring out where to contribute here. But whereas in the Chinese case, you could see there was a proper channel to fund, and in fact to contribute. In the Indian case, you really had this the lack of institutionalized infrastructure, and that led to, definitely later on when I have to talk about, is with regard to the role of technology here. The technology and technology platforms, as Soumya and Cody also alluded to, resonating in your presentations, that the role of technology indeed play a very important role. Like if you see in India and China, definitely. And Meituan was, as Soumya said, and I was speaking to one of my friends in Shenzhen, and he definitely was actually, paying extra. I mean, that wasn't because being a foreigner, he couldn't contribute directly to his Tanwei. Making a contribution for a foreign employee would be quite, could be a kind of it is under. And he said to me that it was his perception that Lian Miansa, like you are not losing your face kind of a situation. So as a foreigner, so he would rather contribute more on his Meituan app to the delivery person than giving straight to his Tanwei. So there are such kind of incidences, events in China that they, and in India, like if you have to see, definitely the record is there as per the established family foundations and family charities and all. But what was the new, the citizenship record? That is always missing. And today, when we have to look into the contributions made by the individual, citizens, or so to say, the general mass, to any of the foundation, it is hard to find by. So the research definitely stops somewhere there. So that was one of the areas that I really wanted to see in future. But at the same time, having said that, so both Indian and the Chinese society and the culture is actually believe in altruism and giving. So, but however, where to give? With a lack of institutional mechanism, that was a big hindrance in India, but not so in China, if you have to see. So that was, and I agree with Professor Xiang, where he said that, the role of, the role of, securitization and redistribution and role of institutions had to come to there. So that is one of and likewise in China, if there were like family foundations which play a very important role in during pandemic, and as well as you could see many number of NBA players, sports persons there as private players, media personalities, and as well as media and film personalities in China. Likewise in India, we definitely had some of the parallels having equal contributions to making donations to these funds. Nevertheless, at the same time, however, in India, I could see some of the trends in my study that I could see that the trends of competitive like bidding, I would say, like who would outstrip whom, and it would rather be reflected on the digital, social media space, than rather than doing. So the trend is like you could see some as inspirers, philanthropists, some as doers who would just donate and be silent and do, and some are always like you could see like some as a kind of a passive, and a balance of contributors there. So there are certain shades of philanthropists existing in India as well as in China also. So, and if we see the donations, like the usual philanthropy foundations that are existing in India and in China, we could see some of the parallels also. Like many of these family foundations in China and in India, although there the parallels, but some of the convergences are that with regard to health. Today, education, as Cody in his presentation, you talked about the role, the health and the education, priorities at rural places, and even in philanthropy today it has been. So I don't know how much in China that with regard to many of these private family foundations pushing into or contributing into poverty elevation programs in rural places. So that can also be reflected maybe in the rural, rural health and education sector. But if you have to say in India, it is usually first, the top three is the education, health, and the disaster management and others. But in the Chinese case, you could see first the education, health, and poverty elevation. So. And also in China, if you have to see the 2016 charity law played a very important actually, it was both an inhibitor and as well as it restricted also many of the foundations, because with the charity law coming into being and not anticipating the 2020-21 COVID crisis that led to many of the funds not to be channelized into the system as well. But whereas in India's case also, many of these diversion of funds happened really in the Indian case, where the existing institutions and NPOs are, so to say, non-governmental organizations not getting adequate funding as per the corporate social responsibility, where at least 2% of the profit they should contribute. But many of these percentage of these corporate social responsibility, a crucial fund to be funded to NGOs and other civil society organizations, were actually directed to the PM Cares Fund, which actually led to many of these societies having no funds at all to function or to carry on their own programs and all. So some of these institutional, lacunas or administrative lacunas or diversion of funds had really led to serious mismanagement among the policies that was exist. And now, if you have to say the perception about philanthropy in India and China, like when I was looking at some of the new reports in China, you could say Chungnan-san being a hero there, a COVID hero. But in India, we look at it as a COVID warriors here. So these are some of the strands that we can really look into how our civilizational or cultural departures really look into. One you see as heroes, one in one society you see as warriors. So who are these warriors and how do you shape them? So and also with regard to in Indian case, if 2016 charity law in China was one of the crucial law that shaped philanthropy in China, the Indian case, as you see, we all have noticed many of our NGOs, the FCRA, the foreign contribution law, really was not the government not accepting or not renewing the FCRA actually led to many of these NGOs or even philanthropy institutions not to really help out. So how do we go about it? So, and in both these societies, with the evolution or with reforms in China, reform after that, and in China the post-liberalization phase, the contemporary philanthropy scene landscape in China was quite in India and China was quite. With regard to increasingly private family foundations coming in, and as well as trust being institutionalized both in China and India, but this COVID-19 and the situation has really brought into serious, relook into the nature of philanthropy in these two countries. Yeah, I think I will stop here and look forward to more Q&A later. Thank you.
Thanks, Beam. Just in time, I was just going to give you the cue to wrap up. So very interesting observations, and insights into what's happening in the philanthropy scene in China and India. In fact, probably I agree that in India, it was, I don't know much about China, but India, you were seeing a lot because you were following these Twitter feeds where a lot of people were helping each other. And this was more like an unstructured kind of a thing where, individual people coming to help someone or the other. And this was, of course, a very different community. But then you have these faith-based organizations also, like the Sikh community coming together and, providing, whether it's groceries, food, or even oxygen cylinders and, finding beds for people. So that was more organized in that sense. But of course, it took some time to reach even that organized. When the crisis was really bad, that's when things started really. The civil society actually started organizing itself, but those were much more scattered and all. So I won't take much time, and I'll move on to Professor Baru, who is the discussant for this panel, and I will give the floor to her for her discussion points, and if she has any specific questions for any of the panelists.
Thank you very much for a very, very enriching set of presentations. And I think what I'm going to try and do is to see how we knit all of this together. Firstly, I think the uncertainty of the pandemic itself threw a lot of issues for the uncertainty of the response. So there was this uncertainty of science, there was also uncertainty in governance, and therefore, there is a lot of common ground between the two countries and very specific differences in both of them. I think I'll begin with Professor Xiang, and I think it's important because his theoretical input was extremely important in understanding two very important aspects of this whole COVID-19 pandemic. One is this question of mobility and immobility. And he used a specific term which I think is very important, that is the securitizing of mobility. And I found this especially interesting when I looked at and listened to Soumya's presentation, that at one level, what was the, and he also alluded to this, that the idea of who is the frontline worker marries very easily with commercial interests in the time of pandemic. And suddenly the consumer becomes very important in all of this. But the flip side of this was also the lack of security for the workers, lack of security for a large number of people who are not just about health workers, but also about sanitation workers and a range of activities that are seen as polluting in a sense due to the COVID pandemic. So you have COVID-19, it's a disease, it is polluting, and who takes on the risks of that pollution is in a sense an interesting aspect for us to look at. And I think both Soumya's and Professor Xiang's work actually shows us this, the way in which the market, came to be accessed by state power to fill in the gaps and to accommodate to a situation which Cody actually refers to, where there's a complete lockdown. When you have a lockdown situation and people cannot move out of their homes, it's interesting that it is the private sector, especially the digital technology marrying with platform companies, that in a sense get accessed by the state also. They get a certain legitimacy from the state, which I think will be here to stay. And if you look at a lot of the responses of the Indian government, this excessive reliance on the future, which is about digital technologies of various kinds, as well as, in a sense, creating a market for what I would call the formalization of informal services. And I think this has come to stay, and one is not quite sure. And I think, Soumya, your presentation clearly brought out the lack of protection of gig workers, say in the Indian context, compared to the Chinese. And I don't know if the kind of protections that were given or were rested for gig workers in the Chinese economy, whether those opportunities are there even for the Indian context. Coming to Cody's presentation, I think we loved your paper, Cody. To tell you the truth, I was Googling and I came across this paper that you have done. And I think it's an important piece of work because it really ties in the contrast that you see between the earlier presentations between the urban and rural in China. We all know and very well accept that in the Indian context, you have these contrasts, but you would think that given the rise in the base of social living in China, that you would not have such stark rural-urban difference, but that there is important that your study throws up. But more importantly, I think the link between unemployment, reduction in wages, and what it does to food security at the household level is very, very critical for public health, as well as for people who are concerned about human development. And what was striking about your paper, which you alluded to in your presentation, and which of course you have much more information on in your paper, is the rationing of food at the household level. And I think there are studies in India which are actually showing you the kind of stresses that were produced at the household level and in terms of intra-household distribution, especially for food, but also very importantly for even basic needs like water supply, sanitation, as well as access to health services. And I think that is really a stark contrast both to the Chinese and the Indian situation. And coming to philanthropy, and I'm very glad, Beam, that you're looking at the question of philanthropy, but the unpackaging of philanthropy and the multiple levels of actors involved in philanthropy and philanthropic activities would be very, very important. It is also the case that the corporate social responsibility that you see in the Indian context, I don't know if there is a comparable in the Chinese, but certainly family foundations are on the rise even in the Indian context, because you're talking about two societies where the rich have really grown in both China and India. And I have a question about religious groups in China. What about religious groups? What was their role, the faith-based organizations? And there were a number of networks, and I don't know if, Cody, you were able to look at what happened in terms of community cohesiveness in the time of COVID. What happened at the community level? And were there any efforts to sort of cohese in the time of crisis? Because you do see that in the Indian context, in largely anecdotal kind of evidences. But the fact that you did have community responses, you had, in fact, young people who worked earlier for maybe platform companies suddenly coming up to, come together to serve food to people who worked in crematoriums, for example, in Delhi. So there were, in a sense, efforts of these kinds that came up. And so what got visibilized and what didn't get visibilized is also an interesting aspect. The social media, use of social media to visualize certain actions by, say, the family-led philanthropic associations versus, others that did not get visibilized similarly, but there were reportings in the newspapers. So what clearly this panel brings home is that there is a great possibility for some collaborative kind of inquiry where you may just be able to take specific aspects that have been discussed in this panel and to counterpoise, even if you don't want to move into a comparative mode, to counterpoise what was happening in India and China. And also, given the large countries that we are, that there would have been very varied experiences also between the less developed, the better developed regions, between the urban and the rural. And somehow I feel that this panel provides the beginning for us to sort of tease out some of these possibilities. The last point I really want to make is about the idea of a logistical power that Professor Xiang spoke about. And I think that it's a very interesting way in which we can look at how state power circulated and affected various aspects of people's lives, including information and disinformation or lack of information. So in a sense, COVID-19 has really strengthened state power, but it hasn't weakened commercial interests. So I think there is this very heady mix of giving legitimacy to markets in a way in which we haven't seen before, I would say. And it has actually accelerated the spaces for commercializations in sectors we never imagined would require that. So I'll stop there. And I think there are probably a number of questions in the chat box. And also maybe we can have a conversation across the panelists if there are no specific questions from the audience. And thank you for a wonderful panel. Thank you, Madhurima, for chairing this session. It was most enjoyable.
Thank you, Professor Baru. I mean, the points were really quite pertinent that you picked up. Would Bhim want to answer one of the points that Professor Baru raised?
Yeah. Thank you, Professor Baru, for that question. As actually, I would resonate with what the earlier special lecture, keynote lecture given by Professor Frank PK, where he talked about with regard to religious institutions in China, and whether they would really, if the party really stands or endorses all the religion in China. So so linking back in China, if you have to see during pandemic, there were actually many religious institutions or associations, so to say, churches and all. They did actually pledge and donated quite a sum of money. However, not every donations were being accepted by the government, because the 2016 charity laws have strict rules with regard to religious institutions making donations to charities and all. So like China Buddhist Association, if I'm not wrong, they're substantial, like 15 to 20 million USDs were being donated. Likewise, Protestant, I think in Wuhan itself, in Hubei, that almost like 1 million USD was donated by the Protestant Church of Wuhan. So yeah, they were definitely, and especially the Buddhist, Taoist temples were always involved, not only at the financial donations and philanthropy, but they were also with regard to kinds, delivering mass, buying mass, and giving in kinds. So definitely there were substantial donations from the religious institutions.
Thank you, Neil. Cody, would you like to answer the point that Professor Baru raised on whether there were any community, charity, or just reaching out to the community in the sense of terms of helping each other?
Yeah, I mean, I think that's something we didn't look quite as much in our survey on, but I think it's definitely, looking back, that would have been a great thing to look at, because I do have more anecdotal, stories of or situations. We actually asked a lot of villagers to send us pictures of what was going on in their communities, and there are many instances of the local militia or the local work group that was at the tables at those sites, doing all the temperature checks. That team, a lot of them were responsible for getting food for people who needed it, who couldn't physically leave their homes. Like on an individual level in communities, yeah, there was certainly a lot of that, not just in rural China, but also across the whole country. And certainly there was more cohesion in communities because of that reason. In terms of from an institutional level, I'm pretty familiar more with education-related philanthropy, and a lot of CSR departments of companies, even if companies didn't have CSR departments, because CSR departments have recently become more popular in China. In companies, a lot of educational technology companies started to give free products that would normally be free, offer free online classes to students, and this was available to everyone. And sometimes they would specifically target rural populations and say, oh, if you're in a rural school, then you'll be able to freely access our software for the next couple months, and so we see those types of acts of philanthropy as well. But in terms of our data, our data, as far as I know, doesn't have any specific information regarding community efforts. We have more information about the effects on the food and health and education and so on.
Thank you, Cody. Soumya, there's one question for you, and I think after that we need to wrap up. This is from Justin Joseph. He's asking, can we link the whole tech economy interaction to neoliberal capitalism? Is it just wait and watch approach, or the state knows what's to be done in the given context of the capitalist world order?
Yes, I mean, I think it's perfectly linked to what Professor Baru just said, right? What we saw through the pandemic was a strengthening of state power while not the weakening of commercial interests. I think in the Chinese context, and I mentioned this in the piece that I wrote for The Hindu, it was in their interest to respond because there was such an overwhelming public opinion in favor of delivery workers. And so it was in their interest to come up with regulations. And also it coincided with the time that tech companies were booming and they also had to rein that in. In India, there isn't really a motivation at this point. It's not that the delivery workers, and in a context of our democracy, they haven't built into a sort of like a electoral sort of base at this stage, right? Like you're looking at a whole group of people who've come from different backgrounds. And so apart from the tag of them being specific to this particular occupation, they don't really are large enough to form any kind of electoral bloc. So I think it isn't in their interest in this case to actually regulate just yet. So what I found interesting, however, is the way the companies use and manipulate delivery workers to further their own goals. So in that context, I think everyone's aware of how the platform economies work, but it's better not to respond because that's how the specific market forces are at the moment.
Thank you so much. And I think we have reached the time, 6:30 it is, and really want to thank this panel for such fascinating presentations. Professor Xiang, Cody, Soumya, Bhim, thank you so much. Thank you so much for being part of this panel. And we hope to be in touch with your work also in the future. And we look forward to that. Thank you. Preksha, do you have any other? Yeah.
Okay. Let me conclude this session by thanking Dr. Nundy and Professor Baru and our 4 panelists. I'd also like to thank our digital partners, The Print, for covering our sessions. The video recordings of all our sessions will be available on the ICS YouTube channel. As we come to end of day 2, I would like to invite you to attend our sessions tomorrow, which is the final day of the 14th AICCS. The first session for tomorrow will be a thematic panel. It'll be on history and cultural linkages, which will begin at 10 a.m. I look forward to your participation and thank you very much for joining us.
Thank you.
Thank you so much.
Thank you, everyone.
Thank you so much.
Bye-bye. Bye.
Bye. Have a good
Thank
evening.
you. Bye-bye.
Bye.